But right now, it's all about the Global Female Condom Day. This is an event that is being marked the world over, and I'm sure that just like me, you are unaware. So I have with me in studio someone from NASCOP who will be putting all that into perspective. Dr. George Gidoka.
Thank you very much.
Welcome to the Morning Express.
Thank you.
So this event that, just like myself, even Sophia, we were all very unaware about it. What is the significance of this event?
Actually, this is the second year that the event has been marked. The first Global Women Condoms Day was marked last year. And basically, the main purpose of the day is to create more awareness about the female condom as an effective method for both HIV and STI prevention and prevention of unintended pregnancies. And as we know, that it's not a very new or a very old commodity all the same. Female condoms have been in use since the 1980s, and there's been a lot of myths and misconceptions about their use, either their ease of use or their difficulty of use, and also that has led to a very low uptake. So the purpose of having this Global Female Condom Day is to create more awareness, to bust the myths and misconceptions, to even advocate for more of them to be available, because also availability of female condoms is very low. Unlike the male condoms, you cannot go to a chemist and buy a female condom. There are no commercially available or socially marketed female condoms. All the ones that are available are from the government. So just basically to create that awareness, also to highlight some benefits or some situations where the use of a female condom might be preferred even to the use of a female condom.
Okay, before we get to that, just to put all this into perspective, this holiday, this event, let me not call it a holiday, this event comes in the wake of the release of the preliminary findings of the Kenya AIDS Indicator Survey.
Yes.
So I'm just gonna point out some of the key factors that emerge. One being that there is definitely a drop in the national prevalence from 7.2% in 2007 to the current 5.6% in the 15 to 64 age group. What does this mean?
Basically what this means is that when you define prevalence just states the number of people living with HIV at a given particular time. And there has been a drop in this, and we can attribute this to the success of our programs on one hand, in that we are getting fewer and fewer infections amongst certain population groups, but also we are having a high mortality rate amongst the people who don't know their HIV status and the ones who are not accessing care treatment services. So when you add up the reduction in new HIV infections plus the mortality, then we find that we have less people living with HIV this year than it was in the year 2007.
And I think the report also says that more middle-aged Kenyans are carrying the virus compared to youth and teenagers.
Yes, that indeed is true. The highest prevalence of HIV occurred amongst the people aged between 45 years and 54, as opposed to the last survey, which showed up between 25 and 34 years. But the purpose, the reason for this is, again, is twofold. We are having fewer infections occurring amongst the youth. The interventions that we put in place for them are working. But also you find that the people who are living with HIV and AIDS are getting older. They are living longer and getting older, and they fall into that age bracket. But also we need to have better interventions targeting the older age groups who also seem to be having a higher rate of infection as compared to the youth.
Now that you mentioned that, because the report actually does say that infections are higher between the educated and married couples.
True. Infections, especially amongst the women, the HIV prevalence was higher as the level of education went higher. And also you find that HIV prevalence, it was slightly higher amongst the people who are married or having a partner who they are cohabiting with, vis-a-vis the people who are single or never been married before. And this highlights that it just reflects on what we've been saying from a while ago, that majority of infections are occurring amongst people in stable unions, marriages, or are cohabiting. And we need to focus more of our interventions to target this, because if we continue the same trend, it impacts even on HIV infections amongst the children, because it's these married couples who again will give birth to children who will be at risk of either acquiring HIV. And
on children, I think for the first time, you actually have statistics on children aged between 18 months to 14 years. And it says that 0.9% of all children in Kenya are actually infected with the HIV virus.
Yes, that is true. For the first time, we were able to carry out a survey that looked at the HIV prevalence amongst this age group. And having it at around 1% is not really good statistics, because it means majority of these are acquiring the infections from their parents. So we need to put in interventions that will ensure that there are no children who are being born HIV positive. Whether or not they are at risk, they should be ensured that they are born, they're taken care of to ensure that they remain HIV negative. But I think what is most worrying with these statistics, as with any other, is that only 4 in 10 of these children, their parents knew their HIV status. So out of these 104,000 children who are HIV positive between the ages of 18 months and 14 years, only around 40% of them, of their parents, know their children's HIV status. So these other 60% are not accessing any kind of care and treatment services for HIV, and this is why we find there'd be a high rate of mortality.
Okay, those are very gloomy statistics. What exactly, what sort of intervention is in place? Because I think it's a bit concerning that we have people walking around who are HIV positive and they are not aware.
Yes, that is true, but I must say it's an improvement, because in the year 2007, only 2 in 10 people who are HIV positive knew their correct HIV status. But in this survey, about almost half of the people who are HIV positive know their status. So it's quite an improvement. But I think for us is to try and scale up HIV infection, especially even amongst children. We need to capture these children when they're coming for clinic, when they're coming to the hospital for any other kind of medical conditions. And we need to find a way of mobilizing more and more children to being tested, and more adults. And I think the main aim of that would be to try as much as possible to identify the ones who are HIV infected.
I think when you say we, you mean you and I, because it is our problem as the Kenyan society.
Yes.
So are more Kenyans getting tested, and what is the ratio of guys who are getting tested as opposed to ARV coverage?
I think the proportion of people who have ever been tested for HIV has improved markedly. Around 72% of Kenyans right now have ever been tested for HIV, which is quite an improvement. But what is gloomy about those statistics, as I said, about half of the people who are HIV positive do not know their correct HIV status. Some of them think they're negative, some have never been tested, so they don't know their status. So I think, as you said, we need to make HIV prevention everyone's business, and we need to find ways of even being able to test the people who might or at a higher risk, so that we can be able to identify more and more of them, enroll them into care and treatment. Because again, from this survey, it showed that over 90% of the people who had been tested and found to be positive were accessing care and treatment services. So it means once you've been tested, you have a greater than 90% chance of accessing quality and care and treatment services. But when you are not tested, then this is where we're talking about the mortality being high amongst these people who have not been tested, and they're not accessing any care and treatment services, so they end up having a higher mortality rate.
Okay, and today being the Global Female Condom Day, what makes the female condoms so unique as a prevention method?
Well, I think female condoms are just like condoms. You know, when you're talking about HIV prevention, there's the ABCs, the abstinence, the being faithful to one partner who's HIV negative, and the third one being condoms. Condoms are central in HIV prevention. And when you look again at our survey, the people who need to be using condoms are not using condoms, and there are various reasons that have been given. But
why do you think that, especially the female condom, why do you think it's so overlooked?
I think it's overlooked. There are a lot of myths and misconceptions about it. We are now on the second generation of our female condoms. The earlier version, up to the year around 2005, there are a lot of complaints that it was a bit noisy, it was a bit cumbersome to use, and a bit uncomfortable. But now we are in the second generation that is much more improved. Much of the challenges that had been highlighted with the first one have already been addressed. It's easy to use, it is comfortable to use, and as I said earlier, there are particular advantages where use of a female condom would be better. If you'll allow me, I can highlight a few. Like, for example, when we're talking about use of a female condom, it's better like for people who are allergic to latex, which is a material that makes male condoms. So when people come and tell you they're allergic to latex, you can advise them to use a female condom. You find when, like for example, women are having their monthly flow, the use of a female condom is better. There is less of a mess during that time when they use a female condom. Female condom is very good for use in women around the premenopause or menopausal time. It reduces the discomfort associated with that. Even the women who have just delivered, it also reduces it's a better commodity to use. But I think most importantly is that the female condom puts the woman in charge.
Yes.
It's a commodity. It's an intervention that the woman decides to use, and it's much better to use because when it's put, it can be put hours before.
And still on that, because as you say, the female condom is woman initiated.
Yes.
It empowers the woman to actually take up this as a prevention method for HIV and STIs. So if there's a woman at home and she finds herself in a situation where perhaps the husband, right, does not want her to use this condom, what are some of the tips you can give them for condom use negotiation?
I think very to put it, the male or female condom, for its use, the couple needs to decide. They need to agree and decide. And I think for there to be better negotiation skills for the woman to be able to use a female condom, first she must have the confidence to be able to use it properly. And when she gets the confidence that she can be able to use it properly, and she has all the correct information regarding its benefits vis-a-vis the inconvenience it may have, it actually, in some instances, it is preferred to the male condom. Because like I started saying, you put it way before, you don't have to remove it immediately after, so there is no interruption in the flow, and it is not it's not uncomfortable at all. And as we've said, is that it really is just like the male condom, as easy to use, and it does not reduce in any way the pleasure of intimacy. In fact, it improves, because you can imagine when you are intimate with a person and you don't have to worry in your head whether you'll get HIV from this person, you'll get an STI, will you get this person pregnant, the lady is not worried, will I get pregnant, is actually a better, you find it improves the relationship between those two people when you don't have to worry about all those things.
Okay, so today being the Global Female Condom Day, 1, woman initiated, empowers the woman.
Yes.
2, there have been concerns over the use of these condoms, where you find instances someone uses one more than once. There's the sharing aspect due to issues such as poverty. What are some of the things that, from where you're sitting, you're doing to help alleviate some of these concerns?
I think we elevated this concern by better educating the people. As I said, most of the female condoms that are available in the country are given free of charge by the government, so the element of cost doesn't come in. Mm-hmm. And also, we are trying to make them as much available to the people who need them. And once this is there and there is proper education, the chance of it being reused is actually reduced, and they create more confidence amongst the couples using them that it is a preferred method of prevention of HIV.
Okay, and finally, because evidently for a lot of people, they will say that it's not readily available in the market. I may want to use it, but I cannot find it. So being a health practitioner yourself, is there anything that the government is doing to make sure that these are readily available for all women, irrespective of their social standing?
Yes, as a government, as I said, all the female condoms currently found in the country are being provided for by the government, and they're being provided free of charge. But I think for us, even the purpose of having the day is to advocate for more players to come in with the female condom. We need to find that they can be found in chemists. You can go to a chemist, you can buy. You can find them as socially marketed, like where the price is substituted and it's cheaper for its use. But I think most importantly is also to advocate. The female condom is quite more expensive than the male condom. But the reason it is expensive is because there is much less of it being procured and much less of it being used. But I believe with the increase in its use and with a lot of advocacy, then we can be able to reduce the price of the female condom to that of the male condom, or even much lower, because it will be needed more amongst, as you said, even women who might not be able to afford, yes, can be able to access it.
Yes, thank you very much, George. I'm sure that you've learned something this morning. Sophia?
Yes, that was a great discussion. Thank you. And I didn't know about the Global
Condom Day.
Condom Day. That is
Female Condom Day.
Female Condom Day, not women.
And that's the great part, because
yes,
I'm sure there are so many women who are watching.
Yeah.
And as he said, it's actually our best bet.
Yeah.
Because it's woman initiated.
I know.
So you get to protect yourself.
Yourself.
You have the power.
Yes. Thank you. Thank you for coming in and talking to us about that.